by Larry Schlesinger, who is the President and CEO of Texas Biomed, as well as Jennifer Harriet, Deputy Director of San Antonio's Metro Health. And this is our COVID-19 update for the San Antonio community. Tonight we're reporting 173 new cases of COVID-19 since yesterday, which brings our total to 44,814 in our community since the pandemic began. That makes our new 7-day moving average of new cases currently 142 cases per day. Unfortunately, we do have a number of new deaths to report tonight, 21 in total, which brings the total from the beginning of this pandemic to 698. These deaths occurred between July 22nd and yesterday, August 20th. 10 of the 21 were confirmed by Metro Health from the death certificates provided by the state of Texas. Again, as we go through these numbers, I always want to remind folks these are our loved ones, our neighbors, our friends, colleagues, so please keep their families in your prayers. Tonight in the hospitals, we're reporting 520 patients, which is down 12 from yesterday, 520 COVID-19 patients. 43 new COVID admissions to the hospitals since yesterday, 232 in ICU, which is down 7 from yesterday, and 153 down 10 on ventilators from yesterday. And that is the lowest number we've reported in quite some time on ventilators, thankfully. As far as capacity, we have 57% of ventilators available, as well as 14% of staffed hospital beds. So our hospital system remains under high stress. Let me turn it to Judge Wolff.
Yeah, thank you, Mayor. First of all, let me thank Leah with Girls Inc. They sent me the face mask and this bandana, so appreciate very much them doing that. You know, I was looking at that number today. We're 520 people in the hospital. It's interesting that it was 2 months ago, give or take a couple of days, June 23rd, we had 518. In other words, it took us 2 months to get all the way back to where we were in that period of time on June 23rd, fighting, trying to get it under control. But also on that day, in June the 23rd, where we had the 518, within 9 days it doubled to over 1,019 in the hospital. Now this clearly shows you, as one other example, how quickly the disease spreads and how long it takes for us to get it back under control. So we're on the right track. It's a slow process. We certainly couldn't get there without the tremendous help of all of you with the face mask and social distance and sanitation and staying away from large groups. But just remember that we cannot let our guard down, because this thing moves fast and furious and it's deadly.
That's a great reminder of how fast this thing moves, Judge. Thank you for that. As you know, you've probably been paying attention to the news on COVID-19, and one of the things that people around the world are waiting for is a vaccine to be developed that will help tremendously in how we fight this disease. The research that goes into a vaccine being created, some of that is being done right here in San Antonio, as it has been done in previous disease outbreaks. And I'm happy to introduce now Larry Schlesinger, who is the President and CEO of Texas Biomed, where some of that very vital research is performed. So turn it over to Larry, and maybe you can give us a lay of the land in the global picture on a vaccine, Larry.
I'll be glad to, Ron. And thank you very much, Mayor and Judge, for having me here this evening. Good to be here and to update you on where we are. There continues to be strong progress on vaccine development worldwide. There's currently 165 vaccines in the development pipeline, and that's occurring really in only 4 to 5 months of the pandemic now. That's unbelievable. We have 32 vaccines that are in clinical trials, including 8 that are currently in the large phase 3 clinical trials, each estimated to recruit approximately 30,000 people. This is really important. These are the large trials that are going to tell us whether the vaccines that are being produced are safe and effective. And of course, we want to ensure for the public that they're safe and effective. And you probably have heard there are 2 that have actually been approved, one in Russia and one in China, although the data are scant, and really I think we should be very cautious about those 2 vaccines. Texas Biomed plays a major role in the preclinical development of the vaccines that you're hearing about. We currently have 4 validated animal models for COVID-19 that we are using to test both new therapies and vaccines. You've probably heard about the federal organization called Warp Speed. We are currently working with 4 Warp Speed companies, and 3 of them with vaccines and one on therapy. Our therapy work is with Regeneron, and that just became a preprint, very effective monoclonal antibody therapy for COVID-19. I'm optimistic that we're going to have antibody therapy for COVID-19. And although we're blinded, from what I understand, the vaccines are looking really good in the animal models. These are being done in parallel with these large phase 3 clinical trials, and that's helping us speed along the progress. Normally, the preclinical trials, the animal models, go on before the clinical trials. And also, there's a gear up on manufacturing in parallel. But I just want to stress that what is most important is that these phase 3 trials are conducted properly, and that we recruit the proper people into those trials so that we can truly assure for the public that they are safe and effective. And as a physician scientist in infectious diseases, I can tell you there's nothing more important, because once we put all the effort in these vaccines, they need to be taken. And right now, the evidence is there's a lot of hesitancy about the vaccines because the focus has been on speed. But really, it's going to be safety and effectiveness before those vaccines are on the market.
Thank you, Larry, for sharing that information. The question that comes immediately after the information on the vaccine is, how are we going to go about distributing the vaccine in our community? And we've already started getting questions about that. So I just want to assure you that Metro Health is working on our vaccine plan in terms of distribution. Very likely we'll do what we've done in the past with different types of vaccines, and that is that you identify the people who are at highest risk, and those are the individuals that you would want to vaccinate first. We would also want to vaccinate our healthcare workers and folks that are working on the front lines, like our child care providers, our transit folks, because those are the people that we want to be able to be working in the community and at lesser risk of being infected. I also want to make a plug for the flu vaccine. So in just a few months, towards the end of September, we should have the flu vaccine available here in San Antonio, and it's going to be real important that we all get vaccinated for the flu so that we can hopefully distinguish between whether we've got the flu or whether it's COVID.
Great. Thank you very much, Jennifer, and thank you also, Larry, for that perspective. And rest assured, the vaccine will be developed just as soon as it possibly can, based on the science. And when that does happen, you will know that San Antonio played a vital role in changing and improving our world with regard to COVID-19. So thank you to the work your folks and your researchers do, Larry. And as always, if you'd like updates on COVID-19, you can get those anytime by texting COSA-GOV to 55000. You can also go to the website anytime at covid19.sanantonio.gov. Please keep up the great work with regard to physical distancing, wearing a mask, personal hygiene, and all the things that our public health professionals are telling us to do so we can get through this together. At this time, we'll go to questions. Jennifer, Larry, myself, and the judge are available.
Dr. Schlesinger, is there any indication as to when the trials might be done and when we would have to see that vaccine available to us?
You know, this is a great question, and what I didn't mention earlier is that several of our hospitals in San Antonio are participating in those phase 3 trials. So it is a team effort, and I think there are a lot of our community members who are stepping up to be part of those trials as an indication of the great service of San Antonio in medical innovations. Phase 3 trials typically take 3 to 6 months, and it really depends on how the recruitment is going. 30,000 people, a lot of people, and the key is that we get a diverse population into these trials so we understand that, how the vaccines are working in the most susceptible individuals in the community. And there are variables. If I look at some of the data coming out, recruitment is up and down a little bit, and that can slow things down. So that's the 3 to 6 month. So then, you know, manufacturing is going on, but it would have to gear up, and depending on the site, that may take six more months or so. So You can add it up, and 2021 would be quite ambitious still. And I want to emphasize again that we really should not be in the market with people until it's safe and effective.
You had mentioned that safety and effectiveness, is that kind of the challenges you may see as we are in this race for one, is to make sure that it is the real deal and the right one?
Yeah, I think race has been somewhat of a two-edged sword in terms of when you're talking about vaccine development. Right now, the biggest challenge is we're learning about the immune system response to the virus at the same time we're trying to develop a vaccine. That's the greatest challenge. And you really do need to assure the public that we're not racing, cutting corners. Instead, we're doing everything necessary to ensure those vaccines are safe. And I think in partnership with Metro Health and other partners, there really does need to be major communication strategy on safety so that we avert the problem of many people not taking the vaccine.
From your initial testing so far, is there any indication as to whether you would have to take that vaccine every year like you do the flu shot?
Right. That's an unknown right now. I think in general, the feeling is that we may not be in a position like flu. There's really no indication that we have the continual change of the surface coat of the virus like you do with influenza. So the hope would be that this vaccine would not need to be changed every year, but that's still a lot more to be discovered. We're still, I think the data indicate the virus is going to be with us for a while, so I think we have to answer those questions still.
In terms of Metro Health and the vaccine plan, is there anything, well, besides it being the coronavirus, unique or different this go around in developing this plan?
I mean, I think as with many people throughout the country, we're learning so much every day that that does cause some challenge to us. But the reality is we will use our experience from previous pandemics or previous situations and adapt our plans to address COVID-19. Dr. Anita Kurian, our communicable disease assistant director, is working on that now, and I think she's best placed to answer those questions.
Mayor, today I spoke to Coates about this new proactive team that is going to go out targeting bars and restaurants. You had mentioned earlier this week you weren't happy with what you saw last weekend, which is why I wanted to talk to him today as we go into this weekend. I mean, how angry would you be if we saw a repeat of last weekend come Monday?
Just as concerned and angry. I mean, again, you heard the judge talk about how long it's taken for us to get this back under control. There's not a soul in this city that doesn't understand the seriousness of what we're dealing with, and we need everybody to cooperate.
Today, the TABC announced that the well will receive an alcohol suspension. They won't be able to sell alcohol for 30 days. What is your reaction to that?
I'm being informed as you're telling me. I guess my reaction is I'm not surprised. The governor has already indicated that they, at the state level, are going to be very aggressive with regard to pulling licenses for alcohol sales in the event of violations of the state order. And, again, we're going to be proactive about doing what we can at the local level, too.
On the first,
We thank the Texas Alcohol and Beverage Commission for being aggressive in this. It's quite a bit of job to try to enforce something like this, and to have the state actually step up and put their muscle behind it helps us a lot, I think.
on the first night of the inspection team, they have already cited 4 businesses. What is your message to those bars and restaurant owners?
To the 4, or to the just generally?
Generally, because they're going to continue to do this until into this weekend.
Hopefully the message is sinking in that we're serious about enforcement, and clearly the state is as well. And really the message is for patrons more than anything. You see if a place that you like to visit has had their license pulled because of the recklessness of their patrons, that's not what people want. If you enjoy going to a place, help them out by doing your part, by wearing masks and physical distancing and all the things that they're trying to do to operate safely.
From a health perspective, to remind folks, if we continue to see what we are seeing with these packed crowds, it's just going to set us back. I mean, what is this going to end up doing to us?
Absolutely. We're going to see another spike. It's going to set us back. So we cannot take our foot off the gas pedal. Any time our numbers start to go down, I think people start to feel a little bit more comfortable, and we just can't do that. We've got to have people continuing to stay home. I was amazed to see what's happening across the nation with some of the universities that have opened up and then have had to shut right back down again. So if those aren't clear signs, and then what's going on in some bars or restaurants, that we've got to pay attention to the rules, the social distancing, the masking, the hygiene. It's really important.
And I would say also that, if you go just drive around, or as you're walking around, you observe how people are handling this. People are generally taking it very seriously, and we're being rewarded for that. The numbers are going down. We're starting to see the infections get under control. We will continue to see those trends happen if we continue to do our part. So it's not all bad news if we can work on this together and continue to do what the professionals are telling us can help contain the virus.
Mayor, from Texas Public Radio, they're carrying it live, so could you please repeat the new cases and the new confirmed deaths?
Sure. The total number of new cases today was 173, and so our moving average today is 142 per day, and we have 21 deaths to report from yesterday. 10 of those 21 are from the death certificates reported by the state of Texas, so they date back as far as July 22nd.
Can you remind us what our positivity rate is?
It was 11.3 as of Monday. It's updated weekly, so we're hoping to see. I would love to crack the single digits again, Henry, on Monday.
Yeah, I hope so. I believe we will. Confident.
All right, thank you.
Thank you, Ryan.